Hi, I'm Dr. Hal Blumenfeld. We're going to demonstrate here how to perform a neurologic exam. The neurologic exam is a powerful diagnostic tool. It can be used to answer many important clinical questions. For example, if a patient collapses on the street, do they have cardiac disease or do they have an intracranial hemorrhage? If a patient develops weakness and numbness of the legs, do they have a peripheral nerve problem or do they have impending spinal cord compression? These are the kinds of questions that can be answered with a neurologic exam. Before we begin, it is important to emphasize that the neurologic exam is just one part of clinical evaluation. Although we will describe it separately here, in reality the neurologic exam should always be performed and interpreted in the context of a more general assessment, including the patient history and general physical examination, which includes the neurologic exam as just one part. A unique feature of the neurologic exam is that it tests function. Because of this, for each part of the neurologic exam, several tests should be done, ranging from easy to the most difficult. The idea is to titrate the patient's level of function, so it can then be compared to subsequent exams. Although there are variations in style from clinician to clinician, we will present the neurologic exam here in a fairly conventional format. The neurologic exam consists of the following 6 subdivisions: mental status, cranial nerves, motor exam, reflexes, coordination and gait, and finally, the sensory exam. Depending on the clinical situation, certain parts of the exam may be performed in greater or less detail, or the order of the exam may be changed to fit the clinical situation. Learning how to use the neurologic exam as a flexible tool and learning how to tailor the exam to the specific clinical situation comes with experience and with practice.